Welcome back, everyone, for another deep dive.
Yeah,
Today, you're going to be tackling a topic that I think a lot of people find really confusing,
yeah,
and that's the differences between ADHD and autism. We're going to try to make it crystal clear
absolutely.
using this article from Cheap ABA. So you often hear these two diagnoses kind of thrown around interchangeably, like they're the same thing.
Right.
And
Yeah,
I think it's understandable because there are some overlapping features.
for sure. And one of the things I think is so interesting about this topic is you can have two people in a room, one with ADHD, one on the spectrum,
Hmm.
and they may be exhibiting similar behaviors,
Okay.
but the why behind it is completely different.
So that's what we're going to try to get to the bottom of today, is that sort of why behind the behavior.
Exactly.
So I guess to start, you know, we've all heard the stereotypes, right? Like the kid with ADHD is bouncing off the walls, can't sit still.
Right.
And the person with autism is, maybe nonverbal, off in a corner somewhere, not
Yeah.
making eye contact.
Right. And the truth is, like most stereotypes, there's a little grain of truth in there,
Yeah.
but they're a gross oversimplification.
Oh.
Because both ADHD and autism really exist on a spectrum. So no two people are going to experience them in exactly the same way.
So you could have two different people with ADHD and they could be
Completely different.
wildly different.
Completely different. You could have somebody who's primarily hyperactive and impulsive. They're always on the go. They're, bouncing off the walls. And then you could have somebody who's primarily inattentive,
Okay.
where their biggest struggles are with focus and organization.
So same diagnosis, very different ways that it's actually showing up.
Absolutely.
Okay. So if we're not going to go with just these sort of stereotypical images of what it looks like,
Right.
what are the real core differences between ADHD and autism?
So at its core, ADHD is about difficulty with attention regulation,
Okay.
executive function, and oftentimes hyperactivity and impulsivity. So think struggling to focus on tasks, getting easily distracted, acting without thinking, and autism. So autism is going to be centered around differences in social communication and interaction, along with restricted, repetitive patterns of behavior. So think about, difficulty understanding social cues, engaging in back and forth conversation, or maybe, a strong preference for routines and rituals.
So somebody with ADHD might blurt out an answer in class because they just they don't have that impulse control.
Yes.
Whereas somebody with autism might not understand that it's not their turn to talk.
That's a really good example.
Yeah.
Because it highlights how those core differences can play out in a very real-world situation.
So this whole spectrum thing is important because you can't just slap a label on somebody and assume you know their experience.
Exactly. And it's about understanding the individual, not the diagnosis.
Okay.
And this is going to be especially crucial when we're talking about social interaction because that's oftentimes a key difference between ADHD and autism.
Mm-hmm. Let's break that down a little bit further. Where do we see the differences becoming most apparent?
So if you imagine like a social gathering,
Right.
somebody with ADHD might interrupt conversations, blurt things out. They might have trouble waiting their turn to speak. But it's not because they don't understand social norms. It's just that impulse control can be a real struggle for them.
So they know they should wait their turn. They just
Right.
they can't.
Their brain is like craving that immediate social engagement.
Got it.
And so they may struggle with that. Now, somebody on the autism spectrum might have a very different experience where they, struggle to initiate or maintain conversations.
Okay.
They might misinterpret those nonverbal cues.
So they're missing those subtle social signals
Exactly.
that most of us just take for granted.
Exactly. So it's not about impulsivity in that case. It's really about like a different way of processing and responding to that social information.
So somebody with ADHD might be dominating the conversation without meaning to.
Yes.
And someone with autism might just be kind of quiet and in the corner
Yeah.
because it's just too overwhelming.
Observing, finding the whole thing very overwhelming. Absolutely.
It's a really critical difference, and I would imagine it makes you think about how you approach things like social skills training, because what might work for one
Absolutely.
is not going to work for the other.
It has to be very individualized. So for somebody with ADHD, we might be focusing on turn taking. We might be focusing on that impulse control, recognizing social cues.
Right.
But for somebody on the spectrum, it might be more about, learning to interpret that body language.
Right.
Understanding those unspoken social rules.
Right.
Maybe even like developing scripts for those common social interactions.
So you're really tailoring it to the person, not just the diagnosis.
Absolutely. One size fits all does not apply here.
And this is where I think we get into this concept of masking, which I think a lot of people have heard of but maybe don't fully grasp. So
Right.
can you explain masking a little bit?
Yeah. So masking is when individuals on the spectrum, consciously or unconsciously, suppress their natural behaviors and mannerisms in order to fit in socially.
So they're camouflaging their autistic traits to
Exactly.
try to appear
Exactly.
more neurotypical.
They might force eye contact. They might try to mimic social behaviors they see in others. They might try to hide their special interests.
Wow. So they're putting on a performance
It's exhausting.
just to get through the day-to-day.
Yes, it's exhausting. And it often comes at a cost. A lot of people who mask experience burnout,
Yeah.
anxiety, even depression, because they're constantly trying to be someone they're not.
It just goes to show you really can't judge a book by its cover
Right.
because someone might seem fine on the surface, but underneath, they're
Exactly.
really struggling.
Exactly. And that's where understanding masking is so crucial, because you can't just assume that somebody's not autistic
Right.
because they don't seem autistic.
Right.
Or they're able to,
Right.
engage in a way that you wouldn't necessarily think.
Yeah, so much to unpack there. I already feel like I'm getting a much better understanding
Yeah.
of just how important it is to be able to look at the individual
Yes.
and not just the diagnosis.
Absolutely.
And how our assumptions about what we think we're seeing
Right.
might be way off base.
Yeah.
And really doing a disservice to that person.
For sure.
So I think this is a great foundation
Absolutely.
for understanding some of these really key differences
Yeah, absolutely.
between ADHD and autism.
For sure.
It's amazing how much we think we understand about something
Yeah.
until you really start digging into it.
It really is.
And I feel like both of these diagnoses are definitely things that,
Sure.
we make a lot of assumptions about. And when
Yeah.
you actually start, like we are in this deep dive,
Yeah.
really kind of peeling back the layers, it's like, oh, okay,
Right.
there's more to this than meets the eye.
There's so much more to it.
One of the things that I wanted to ask you about that I think we see in both ADHD and autism is sensory stuff.
Yes, that's a big one. And that is such a good example of where that, why behind the behavior can be so important.
Okay.
Because you can have somebody with ADHD who, is fidgeting or squirming
Right.
because they need more movement to help them focus.
Okay.
It's about seeking stimulation.
So it's not that, like, the tag on their shirt is bothering them.
Right.
It's that they actually need
They need to move their body.
to engage their brain.
Yes, to help them. Yeah.
Okay.
And then you have somebody on the spectrum who may be reacting really intensely to certain textures or sounds or lights
Okay.
because their sensory processing is heightened. And so those sensations that you or I might, not even really be registering
Right.
are really overwhelming and painful for them.
So it's like all of their senses are just like turned up to 11.
Exactly.
And what might be a normal sensation for us
Right.
is just hitting them so much harder.
Exactly.
Okay, so you could have two kids in a classroom, one's fidgeting because of ADHD, one's fidgeting because of sensory stuff. And unless you get to the why of that,
Yeah,
you're not going to be able to actually help them.
exactly. You're going to approach it in completely the wrong way.
That makes so much sense. And it's interesting because it's like looking beyond the behavior and trying to understand what is that individual's experience.
Yeah, absolutely.
Another thing that I wanted to touch on that I think we see come up in both of these is emotional regulation.
Yes.
So I feel like as a society, we sort of throw that word around a lot.
Yeah.
They just need to regulate their emotions better.
Right, yeah.
But I think for people who maybe haven't experienced these things, it's hard to really grasp what that means.
Right, because we all struggle with emotional regulation to some degree.
Of course.
We all have moments where we're, feeling overwhelmed or reactive or whatever.
Yeah.
But it can be especially challenging for individuals with ADHD or autism.
So in what ways does that manifest differently?
Okay, so let's say you're at a restaurant and your food's taking forever to come out.
Okay. Getting hungry.
You're super hungry, you're getting impatient.
Yeah.
Somebody with ADHD might have a really hard time controlling those feelings of frustration.
Okay.
And so they might, blurt something out. They might get up and start pacing around. They just need to do something.
So it's like their emotions are going from 0 to 60
Yeah.
and they haven't quite figured out the braking system.
Right.
So they're just
They're feeling those emotions really intensely.
Cool.
And they don't have that same ability to kind of regulate their response in the moment.
okay. Now, if we're at the same restaurant
Yeah.
and somebody on the spectrum is having a meltdown,
Yeah.
it could be for a totally different reason.
It could be for a totally different reason.
Like what?
It could be that, the noise level in the restaurant is just really overwhelming, or the lights are too bright, or maybe, their food came out and it wasn't what they expected. And that unexpected change is really difficult for them.
So it's less about, in that situation, it's less about the impulsivity
Right.
and more about maybe sensory overload or...
Yeah, it could be sensory. It could be that difficulty coping with those unexpected changes
Okay.
that might not, even faze someone who doesn't have those same sensitivities.
Right. So it's going back to the why.
Right.
And just because two people are reacting the same way
Exactly.
doesn't mean that the reasons behind it or the way that we should approach it
Exactly.
is going to be the same.
Exactly.
This is really fascinating stuff.
Yeah. It makes you realize,
It's
how much we take for granted
we do.
just in terms of
How our brains
yes, in terms of how our brains work.
process information,
Right.
how we experience the world,
Absolutely.
and just the fact that, my normal is not your normal.
Not your normal. Exactly.
That's okay.
And that's okay. And in fact,
Or more than okay. It's what makes the world beautiful and interesting.
it's what makes the world beautiful and interesting. It underscores the importance of creating those supportive environments
Okay.
for both individuals with ADHD and those on the spectrum.
So how can we do that better? What does that look like in a practical sense?
Well, it starts with recognizing that what works for one might not work for the other,
Okay.
right? So for someone with ADHD, providing opportunities for movement, breaking down tasks into smaller, more manageable chunks
Okay.
can be really helpful. Whereas for somebody on the spectrum, creating those predictable routines, giving them that advance notice of changes,
Right.
providing those visual supports to help them process information.
Okay. So it's really about understanding, like you said, those individual needs
Yes, absolutely.
and adapting our approach accordingly.
Yes, one size fits all.
Instead of just assuming
Does not apply here.
that everybody needs the same thing.
No.
We need to actually
Meet them where they are.
meet people where they are.
And provide the support that makes sense for them.
It's like you wouldn't use a hammer to tighten a screw.
I love that analogy.
And you wouldn't use a screwdriver to pound in a nail.
You're exactly right.
It's about using the right tool for the job.
Right. And understanding what tools this individual needs to succeed.
Yes.
And how can I provide those tools to them in a way that makes sense?
I love that. This has been, we're only 2/3 of the way through this deep
I
dive.
don't know, right?
But I already feel like my brain is
So much information.
buzzing with all of these different
Yes.
insights and
Yeah.
connections. And
Right. Yeah.
it's really incredible.
It is. It's amazing how much is out there.
It is.
And how much we're learning all the time.
Yes.
About-
and how much we still don't know.
Absolutely. So much we still don't know. Exactly.
They're getting there,
We're getting there.
which is exciting.
It is exciting. It's a really exciting time to be, I think,
Yeah.
in this field and be having these conversations.
Absolutely. Yeah. So we're going to take a quick break, and when we come back, we're going to delve into...
Yes.
We've covered some serious ground today, listeners. ADHD and autism, they're definitely not as simple as they seem from the outside.
It's so true. So many layers.
So for anyone listening who might be thinking, okay, but how does this actually help me? What's the biggest takeaway from all this?
It really boils down to empathy and understanding,
Okay.
right? When you encounter someone who's maybe struggling with focus or social cues or emotional regulation,
Yeah.
don't jump to conclusions.
Yeah.
Don't assume it's laziness or rudeness or bad behavior.
Right. There could be something else going on.
There could be this whole symphony of neurological differences playing out beneath the surface that you're not even aware of.
And this goes way beyond just ADHD and autism, right? It's really about recognizing that
Absolutely.
everyone experiences the world.
Yes, in their own unique way.
And that's okay.
That's more than okay. That's what makes the world beautiful and interesting. We all have our strengths, our weaknesses, our unique ways of processing information, interacting with the world.
Right. So instead of trying to fit everybody into this, neat little box,
Right, exactly.
we should be celebrating those differences.
Yes.
And seeing them as assets, not deficits.
Couldn't have said it better myself. When we embrace neurodiversity, we create a much richer, much more inclusive world.
I love that. Shifting our perspective from judgment to curiosity.
Exactly.
Instead of what's wrong with you, it's what's your story.
Yes. How do you experience the world?
And it all comes back to that understanding,
Absolutely.
right? Educating ourselves, challenging those old stereotypes.
Yes. And the more we learn about ADHD, about autism, about the beautiful spectrum of neurodiversity,
Yeah.
the better equipped we're going to be to create a world where everyone feels seen, heard, and valued for who they are.
Beautifully said. We've covered a lot of ground in this deep dive. My brain is like buzzing with new insights. I don't know about you.
As always, it's a pleasure exploring these topics with you.
A huge thank you to you for lending your expertise to this conversation, and of course to our amazing listeners for joining us on this journey.
Absolutely.
Remember, knowledge is power, and understanding is the key to unlocking a more inclusive and compassionate world.
I love that.
Keep asking questions, stay curious, and embrace that beautiful diversity of the human experience.
Beautiful.
We'll see you next time for another deep dive.